Abdomen, side view of baby. Midgut sends diverticulum known as vitello-intestinal duct, which forms a content in umbilical cord. Hindgut sends diverticulum known as allantois, which forms a content in umbilical cord. Apex of urinary bladder has allantois. Urinary bladder and urethra develops from urogenital sinus, which is terminal part of hindgut cloaca region. Normally, these two diverticula should obliterate. If allantoic duct is not obliterated, urine present at umbilicus in a newborn known as urachal fistula. If vitelline intestinal duct not obliterated, fecal matter present at umbilicus known as Meckel's fistula. If allantoic duct not obliterated, urine present at umbilicus in a newborn known as urachal fistula. If vitelline intestinal duct not obliterated, fecal matter present at umbilicus known as Meckel's fistula. Urachal fistula, Meckel's fistula. Magnified umbilical cord. Yolk sac forms gut tube which has foregut, midgut, hindgut. Yolk sac communicates with midgut with the help of vitelline intestinal duct. If vitelline intestinal duct is not obliterated, leads to Meckel's anomaly. Meckel's diverticulum. Persistence of vitelline intestinal duct. Meckel's diverticulum attaches to terminal part of ileum, which is a portion of midgut, and has a fibrous attachment with umbilicus in anterior abdominal wall. Mesentery is attached to the posterior abdominal wall on anti-mesenteric border. Baby burn with fecal matter in umbilicus is due to Meckel's fistula. True diverticulum with all layers of gut tube, mucosa, submucosa, muscularis externa, serosa. Referred pain is felt in periumbilical region. Meckel's diverticulum, persistence of vitelline intestinal duct, attaches to the terminal part of ileum and has a fibrous attachment with umbilicus in anterior abdominal wall. Mesentery is attached to the posterior abdominal wall and anti-mesenteric border. Baby burn with fecal matter in umbilicus is due to Meckel's fistula. True diverticulum with all layers of gut tube, mucosa, submucosa, muscularis externa and serosa. Referred pain is felt in periumbilical region. Urachal fistula. Hindgut diverticulum surrounded by two umbilical artery, two umbilical vein. Latter two right umbilical vein regresses and left umbilical vein is left. Hindgut forms urachus in adults. No patency of lumen. If there is patency of lumen in urachus, it brings urine from apex of urinary bladder to umbilicus known as urachal fistula. Urachus. Urinary bladder apex have the attachment of allantois in fetal stage, and in the adult it becomes urachus, which is content of umbilical cord. Median umbilical ligament with urachus is covered by peritoneal fold in midline known as median umbilical fold. Median umbilical ligament forms umbilical artery covered by medial umbilical fold, peritoneal fold. Proximal part of umbilical artery persists in adult. Superficial vesicle artery supply urinary bladder. Left umbilical vein runs into liver and is carried by double fold of peritoneum called falciform ligament of liver. Left umbilical vein obliterates to form ligamentum teres, a content of falciform ligament of liver. Left umbilical vein runs into liver and is carried by double fold of peritoneum called falciform ligament of liver. Left umbilical vein obliterate to form ligamentum teres, a content of falciform ligament of liver. Transverse section of umbilical cord covered by amnion. Inside has Wharton's jelly, remnant of vitello-intestinal duct, remnant of allantois, two umbilical arteries, one umbilical vein. Important information. Right umbilical vein regresses normally. Right umbilical vein regresses normally.